factors influencing COVID-19 vaccine hesitancy in patients with multiple sclerosis. So the presentation outline, I'm going to give you a background to why I chose this systematic review, tell you a little bit about what my research questions are, the databases I'm using, some of the search terms, inclusion, exclusion criteria, what my main outcomes are, and how I'm going to be assessing quality and data extraction. So in November 2019, we saw the start of the pandemic, and since then, more than 258 million cases of COVID-19 and 5.15 million deaths have been reported globally. So limited effective treatment methods for the virus have led to the reliance upon the COVID-19 SARS vaccination as a primary method to control the spread of this virus and bring down both infection and death rates. So at the moment, vaccination remains one of the most effective methods to lower the spread and clinical seriousness and potentially eradicate communicable diseases. However, as you're probably aware, that despite the renowned benefits of vaccines, there's a lot of vaccine hesitancy across the world. SAGE defines this as a delay in acceptance or rejection of vaccination, regardless of having access to the vaccination services. So currently, vaccine hesitancy is a major threat to herd immunity, which is crucial in eradicating the virus at a global level. So there's been lots of research done on the reasons why there's so much vaccine hesitancy, and often research has shown it's lack of confidence, misinformation, and inconvenience. And this particular study I looked at here was looking at the influenza vaccines. So people from across the world are resisting the COVID-19 vaccine despite it being readily available to them. So again, like I said, some of the main reasons in particular for COVID-19 vaccine hesitancy have included a lack of trust in the effectiveness of the vaccine, the unknown side effects, and the fact that there was not enough time since the creation of the vaccine. And people sometimes have said that they don't know what's gone into it and the impact it's going to have. So it needed to have been tested for a longer period of time. Also, distrust in the content of the vaccine and lack of trust in government. So there's lots of reasons why people are refusing to take up the vaccine. But again, public health authorities across the world have attempted to increase the uptake of vaccine hesitancy by putting in place some interventions, such as which have included educating people about the effectiveness and the content of the vaccine, as well as attempting to increase social cohesiveness. And one of the ways in which they've done this is by getting the people who've already received the vaccine to then talk about the benefits to others for receiving the vaccine, which has been a tried and tested method previously. So COVID-19 patients who also have chronic illnesses are such as, so these patients such as those with diabetes are more likely to be hospitalized and have a higher death rate and decrease survival rate as compared to non-diabetic patients. Patients with chronic conditions such as autoimmune or inflammatory rheumatic diseases are also at greater risk of increased infections and mortality due to their impaired immune systems. So what we're seeing is that if you have a chronic condition, you're more likely to be affected by COVID-19, which can quite often lead to much more serious conditions and sometimes even death. Again, some research here found that patients with chronic autoimmune and inflammatory rheumatic diseases were hesitant about taking the COVID-19 vaccine due to the lack of information from doctors regarding the efficacy and the side effects of the vaccine, and also because the vaccine was developed quickly and therefore presented as a fear of not knowing enough about the vaccine's potential. So considering this research, it's important for us to address the barriers and concerns this particular group of patients have regarding the vaccine so that they become more willing to take up the vaccine and improve their health chances. Okay, and I was really interested in looking at multiple sclerosis. So patients with multiple sclerosis are considered high risk in most countries, and they are prioritized for COVID-19 vaccination. The main reason for this is because MS patients' immune system is undermined, and the patients are more likely to pick up infections in their bladder and chest and other parts of their body when compared to patients without MS. So COVID-19 in MS patients increases the risk of severe infection and mortality rates, thereby making this patient group a high-risk group. Vaccine hesitancy in MS patients has been an issue before the COVID-19 pandemic, and it continues to stop MS patients from receiving the vaccine. So it's nothing new. It has been around before COVID-19 vaccine. But recent research articles have reported some of the reasons for vaccine hesitancy in this particular group include the perception of the condition worsening if they take the vaccine. The lack of trustworthiness of information that's being provided to them, and the belief that the risk of not receiving the vaccine to them is not very high. So due to the high risk posed by the COVID-19 virus to MS patients, it's vital that every patient receives the COVID-19 vaccine. So a systematic review investigating the factors associated with COVID-19 vaccine hesitancy in MS patients is needed, so these factors can be addressed by health authorities, and we could then look at increasing the uptake of the vaccine in such patients. To date, there has been no systematic review which has looked at MS patients and COVID-19 vaccine hesitancy. So this review could be used to inform health policies and interventions designed to increase vaccine uptake, in particular for this population. So that was the main reasoning behind this systematic review. And my research questions, I was initially interested, well, this is my primary research question. What are the barriers and enablers that influence decision making in COVID-19 vaccine acceptance in patients with multiple sclerosis? But I also felt that in order to address this question, I needed to have a look at what proportion of patients with MS are hesitant in accepting the COVID-19 vaccine, and what proportion of patients with MS are willing to take the COVID-19 vaccine, along with how many have actually accepted the COVID-19 vaccine. So it gives me a more clearer picture of what's going on. I've used the following databases to search for my papers: PubMed, PsycInfo, Prospero, Web of Science, Cochrane, and in particular I found useful the hand searches from relevant papers reference lists. So my search terms, I haven't included them fully here. However, the three main terms that I'm searching for are vaccine hesitancy, COVID-19, and multiple sclerosis. And I guess all the synonyms that have been associated with these three terms. My inclusion criteria was that I was going to only include those that are over 18 and have actually been diagnosed with MS. And all of the papers that I include must look at vaccine, must report vaccine hesitancy in patients with MS. And again, only studies that are published in peer-reviewed journals. I will look at both patients, inpatients and outpatients, and of course the timeline from November 2019 to February 2022 for looking for the timeline in regards to this topic. Both qualitative and quantitative papers are included. And my exclusion criteria is obviously those that are under 18, any papers that are not in English language, and anything that is in the form of a systematic review, interventional study, editorials, methodological articles, unpublished papers, etc. So my main outcomes, when I'm looking at, I'll be looking at measures of effect, means, and odds ratio, where they are provided in relation to the main outcomes that I'm looking at. When it comes to factors associated with vaccine hesitancy or uptake, then again, these may be reported quantitatively. So again, significant predictor, odds ratio, means and effect size. And then in some of the papers which are qualitative in nature, I'll be looking for themes from the interviews and collating them together. In terms of risk of bias, I've used the critical appraisal skills program, qualitative studies checklist, and the quantitative studies checklist as well. Data extraction, again, is being carried out by 2 reviewers, and the data extraction really looks at authors, titles, the country in which the study took place in, the sample size, study design, age of participants, gender, ethnicity, settings, method of data collection, and the main findings. And currently, I say searches are still in progress, but they're pretty much completed now. And I have found a number of relevant papers, and a lot of the papers have come from countries across the world. So it seems to be quite a popular subject area that's being researched. And I'm going to analyse the papers and write up the remaining part of the systematic review in the coming weeks. And I'm looking to publish this, with it being quite a relevant topic at the moment with the COVID-19 vaccine programme. And that's it really. That's my systematic review. I have registered it with Prospero, and my supervisors here at London Met are, my main supervisor is Fazala Rashid, who I believe is here, and also Anna Baker. And if anybody has any questions for me, I'm going to hang about for a bit, and then I've got my email address here as well. If you want to contact me.
Absolutely impeccable timing. Absolutely perfect.
Got my timer on.
Yeah, a model for how to do this. Really crystal clear presentation. Brilliant timing. Thank you very much. And I will be inviting people to ask you questions
Sure.
at the end, but I'm sure there'll be plenty. I've got some as well, but I'm going to hold back my questions. Give other people a turn. Okay, thank you so much for that.
You're welcome.
Right. Our next presenter is Justin Webb, who's an associate professor of public health, and he's going to be talking to us about a rewilding project he's currently working on. There you are, Justin. Have we got slides for you?
Oh. There we go. I'm sharing my screen, so hopefully everyone
Brilliant.
can see that.
Well,
great.
Justin, over to you. Okay,
thank you. So thank you for inviting me to present today. So I'm going to present a study protocol. Well, it's research that's ongoing, so it's kind of an update on where we are at the moment with this project, which is called, we've called it Wildways. It's about influencing pro-environmental behaviours to facilitate urban rewilding. So there is an urgent need to rewild cities to mitigate alarming biodiversity decline, and private gardens in London, we're looking in London, are central to that work. But changes in how residents manage their spaces by reducing vegetation, paving over lawns, is having a significant impact on wildlife. Now, architects and urban designers can propose initiatives to rewild gardens by increasing their greenery to reverse that trend, but encouraging positive pro-environmental behaviours in residents, such as adding plants, water, habitat boxes, rather than paving over front gardens or felling trees and laying artificial lawns, is going to be crucial to that success. So this particular piece of research is a cross-disciplinary project applying behavioural science methodologies and design research together, and aims to investigate pro-environmental behaviours in relation to improving biodiversity of private gardens within Greater London. And ultimately, at the end of this, our aim is to develop an intervention strategy using the design-led Rewild My Street website and urban rewilding campaign as a test case. Now, I am sharing my screen, so hopefully I'm going to skip on to the next slide and hopefully you can see that. So London is the 4th most populous city in Europe. We've got 9 million inhabitants and the 27th most populous city in the world. The Greater London area covers a geographical region of 1,569 square kilometres. In July 2019, the National Park City Foundation declared London as the world's first national park city, a movement which is encouraging Londoners to make London greener, healthier and wilder, and that's supported by the Mayor of London. Now, I know this is a health conference, so bringing the health into this as well, the United Nations Sustainable Development Goal number 11 aims to make cities resilient and sustainable. And obviously there are huge health benefits to greening our city. Existing policy in England focuses on greening new buildings and public spaces with a biodiversity net gain, a condition of planning permissions in England. The Mayor of London's environment strategy embodies this approach, but also acknowledges the need for guidance for residents on managing gardens for biodiversity. The size of this, there are an estimated 3.8 million garden plots front and back within Greater London, and private gardens make up approximately 24% of Greater London, of which 57% is vegetated cover. So that means over all of that, 14% of Greater London is made up of private garden space. So there's an awful lot that could be done here. And what we're trying to do, as I say, is to bring urban rewilding to the private gardens in London to help all of these different species that you can see on your screen. So, I mean, let's consider a normal street topology. This is an aerial view. So if you are, an animal or a bird, and you're looking down, you can see actually we can create these huge habitats. So yes, these are separate gardens, but actually when we look in between the green dotted lines, these are corridors between different habitats, fields, and actually if we can work with people to rewild their streets, then these areas here can actually be huge habitats that can encourage greater biodiversity and the transition of different species from one place to another. So it's not just individual gardens we're looking at. When we piece these together, they become a much larger area. So encouraging the positive environmental behaviours in residents, such as adding plants, water, habitat boxes, and as I've mentioned, rather than paving over or felling trees and things like that, is incredibly important. Greening streets for biodiversity provides ecosystem services, such as improving air quality, reducing urban overheating, and flood risk associated with climate change, and better health and well-being for residents. A change in the behaviour of Londoners to transform their gardens could support these outcomes. Now, there is a need for specificity, and that's highlighted by the vast heterogeneity and inconsistency in pro-environmental behaviours. For example, a person can behave environmentally in terms of recycling, but then could also regularly drive short distances, which could otherwise be taken by active travel. So the determinants of different behaviours are different, and they're context specific. So this research aims to understand and influence the conscious, intent-orientated rewilding behaviour of making adaptations to one's own private garden. Now, my co-author or my colleague who's involved in this research, Sean Moxon, also within the university, has managed to gather some of people's views already from work she's done. And it's things like, it's irrelevance of nature in a city. There's a lack of space, busy lives. I plan to replace my lawn with artificial grass because I'm lazy. These are comments and quotes that she's gathered. Pests, uncharismatic animals and plants, unwanted species. I think we'd only get crows and gulls. Bites, stings, water, health and safety fears. I don't want flowers. In any case, my children get stung by a bee, may get stung by a bee. And then undesirable aesthetics. So I don't want pigeon on my balcony. You can read there. So, mass decay, death, killing, those sorts of things. So we've got some understanding of what these things might be, but we wanted to investigate this further so we can understand this very specific behavior. So pro-environmental behaviour is defined as individual behaviours contributing to environmental sustainability. And to date, much of this work has focused on understanding and changing the automatic decision processes that people make, which have an impact on the environment. So, as I mentioned, things like recycling. What hasn't happened is research into this very specific area of understanding gardening for wildlife or gardening for biodiversity. So this is what we're trying to bring to this particular project, and there are a number of stages. Firstly, we want to bring behavioural science to this and understand this very specific behaviour. Now, there are three major challenges in planning effective behaviour change interventions, which is our ultimate goal. And number one is the correct identification of change objectives. Number two, the appropriate selection of behaviour change methods. And number three, implementation of an intervention strategy or implementation strategy. An author called Peters in 2015, in his paper, A Practical Guide to the Effective Behaviour Change, How to Identify What to Change in the First Place, highlighted the importance of the correct identification of areas for change, suggesting that a systematic search and synthesis of the existing literature, a qualitative exploration of behavioural determinants, and a quantitative verification of determinants and beliefs is a good approach. Now, we wanted to hang this on a framework, so we've selected the behaviour change wheel. Now, many frameworks exist upon which behaviour change interventions can be based. However, it's not always clear which is the most comprehensive and conceptually coherent. And this particular framework aims to overcome that and is a synthesis of 19 different behaviour change frameworks. It incorporates three sections. So in the middle there, we've got the behavioural model called the COMBI model, which stands for capability, opportunity, and motivation, which influence behaviour. And then the first section of the wheel, we have intervention functions. And then the second section, we have policy categories. So just to quickly explain the behavioural model and then the intervention functions and policy categories. This particular model suggests that for a behaviour to occur, somebody needs to have the physical capability to do it, the psychological capability to do it, the physical opportunity, social opportunity, reflective motivation, and automatic motivation. So that understands the behaviour. Then we have these intervention functions that try and influence behaviour. So education, persuasion, incentivization, coercion, training, enablement, which means reducing barriers or increasing capability beyond education and training, or opportunity beyond environmental restructuring, which I'll come on to in a second. Modelling, so providing an example for people to aspire to, environmental restructuring, and restrictions. So these are the intervention functions that could be selected. And then this final layer of the behaviour change wheel, policy categories, how you implement those intervention functions, how you bring them to life. So environmental and social planning, communications and marketing, legislation, providing a service, providing regulations or rules and principles, using fiscal measures, or producing guidelines. So we've used this as the behavioural model and the intervention development framework that we're hanging our research on. So we've got three main objectives. Firstly, a scoping review of the existing literature on the intent-orientated pro-environmental behaviours with a focus on urban rewilding, framed using the COMBI model and the behaviour change wheel, followed by sequential mixed methods research, including interviews, and a quantitative survey to understand the capability, opportunity, and motivational factors that influence urban rewilding, before going into phase 3, our third objective, to co-create an intervention strategy with a group of London residents to promote urban rewilding using the behaviour change wheel, considering intervention functions, policy categories, and behaviour change techniques. So the first stage, which is where we're at, which is the literature review, a scoping review. So our study protocol has been published in a journal called Cities and Health. We've run two searches already, one focused on the terms of pro-environmental or pro-conscious or green behaviours in cities, and the term behaviour, which you can see in this first search string at the top, and then a second search which looked very specifically at gardening for wildlife, or gardening for nature, or gardening for biodiversity. We had a third search which looked at the grey literature as well, which went to key charities in this area, key non-governmental organisations, and searched their websites for rewilding, for behaviour, and for gardening, to try and identify relevant literature there as well. We had over 6,000 results. We've now, following a title and abstract and full review, we're down to 46, and there are currently 8 of us working on coding the literature that we found using the COMBI model. So we're looking for key things that identify an understanding of this behaviour in terms of capability, opportunity, and motivation. And secondly, we're also coding for any identified intervention functions or policy categories that have influenced that behaviour from the literature. So the idea is that that will then feed into the next stage to help us understand some of these key things that might influence behaviour, and some of the questions we need to ask as part of our interviews. We are going to do a critical appraisal. We're using 6 kind of key questions that are taken from a book by Helen Aveyard on doing a literature review, just so we can scope the literature, understand, give it some critical, but because it's going to be a wide variety of literature, we've used this model rather than something like the critical appraisal skills program as mentioned in the previous presentation. The next stage is to do interviews and qualitative survey. So firstly, we will be interviewing hopefully upwards of 18 to 20 people. We're going to try and group people by those that have already taken part and done some gardening for wildlife, some that might be considering it, and some that haven't even considered it at all yet, or might not know anything about it. So we'll be doing some interviews with a topic guide based on the findings from the first stage of this research. We'll thematically analyse those interviews, and then from those interviews and the first stage of the research, our plan is to create a survey which will then send out to a big group of people, as many as possible, to get relevant confidence intervals and margins of error. We're looking at upwards of 400 people, which will have a series of statements like, for me to rewild my garden, I would need to, and then people will put their level of agreement to these statements, and they'll be based around, again, capability, opportunity, and motivation. So we're trying to make sure that we're systematically understanding the behaviour, checking what we found in the literature with qualitative interviews, and then I guess kind of building a bit of a theory of what we think might influence this behaviour, but weight the capability, opportunity, and motivational factors. So are some of the factors we found more important than others? We'll also be collecting things, age, gender, where people live, house type, garden size, ethnicity, so we can then begin to create a model as well about, do different people find different things important in terms of their capability, opportunity, and motivation to influence this behaviour.
Got 1 minute, Justin.
No problem. So once we've finished that at stage 2, then we want to take all of this knowledge to co-create an intervention using the Rewild My Street campaign as kind of the test case, is the base for this. looking at the key stakeholders that we might need to influence to bring about a change, identify what actually is changeable, what we think is going to have the biggest impact, and then co-create an intervention strategy. There is a fourth stage to this, which we haven't covered in our study protocol as yet, which is once we've created this, how do we demonstrate its impact, that it actually has improved urban rewilding. And the reason for that is we will obviously be basing the research and the best methods to use to understand the impact based on what we design. So there is a fourth stage, but that will be coming later. So just to finish off, if anybody is interested in even supporting this research and getting involved in helping us code the 46 papers that we found, then please do get in touch. Or if you're interested in the other stages in terms of, maybe helping conduct the interviews, transcribe the interviews, thematically analyze the interviews, then do let us know. Or even if you just want more information, then drop me a line.
Thank you very much, Justin. Gosh, you managed to pack a lot in there. You're obviously very busy at the moment. So I think Justin needs some help, people. So if you're interested, do follow up on his invitation. Right, we've got about 15 minutes for some questions. I want to suggest is we start the questions for Fazala, if that's possible. So has anyone got any questions for her?
I do have a question, Justin, no, Duncan. Can I go ahead?
Go on then, go on.
I don't know if the chat, we should look first on the chat.
I didn't see any questions there.
For Fazala, I just thank you very much for your presentation, and it's such an interesting topic, because there are many papers or concern about vaccine hesitancy in general, but there is an issue more and more coming from a specific condition, particularly people who are, as in your case, in multiple sclerosis, suffering from immunosuppressed type of disease, such as blood cancer is one of the groups that have been quite voicing or claiming issues around boosters and so on, and cancer patients and people with arthritis and so on. But I think it's important, so as we're going along, to probably analyze those behaviors in relation to, as well as you are trying to unpack in your research, what happened to those pre-morbidities or preconditions. Now, one question I have more specifically is whether are you interested only in vaccine hesitancy or also vaccine resistance, and whether you are sort of interested in unpacking or approaching this within these two perspectives of only vaccine hesitancy?
I'm really interested in what makes them want to take it up, and what prevents them. So the enablers and the barriers, that's my main area of interest. And I do agree with you, there's a lot of work that's being done at the moment with lots of different chronic conditions and vaccine hesitancy, in particular COVID-19 vaccine hesitancy, especially in cancer patients. But again, there's lots of conditions. For example, whilst I was doing my research, diabetes, people with diabetes are significantly at risk, and a large percentage of them are refusing to take the vaccine. And again, that's something that needs to be researched.
Yeah, further. Thank you. The question was, yes, exactly, sort of a bit more of some people could be hesitant, meaning that they have doubts, they're uncertain, as you mentioned, but some people are refusing, which is sort of a different type of behavior. So that was I think the key question that I was asking.
Yeah, I'm looking at the reason why they're refusing as well. So
Okay.
what proportion are refusing, and
Right.
why are they refusing?
Thanks, Fazala. Actually,
Brilliant. Thank
just
you.
following that up, and this is a very kind of seemingly dull question, but I was interested to know approximately how many eligible papers do you think you're going to have?
At the moment, I've got 11.
Oh, that's a good number. You don't
Yeah.
want madness.
Oh no, it's 11, and at the moment I'm just going through the quality assessment of them. So I'll determine how many are going to actually go into the review, but more than likely most of them probably
Sure.
will.
Any from the
I can't say
UK?
that for sure until I've done it, but yeah.
Are they all non-UK?
No, some are from the UK. Oh, they're from all across the world. So I've got Iran, I've got America, Saudi Arabia, lots of different countries,
Sure.
but
Right.
UK included.
Okay. Quick question for Fazala from anyone else? Well, thank you, Fazala, for clarifying those points, and we all wish you the best with continuing your review. It should be very interesting. Any questions for Justin? Oh, you're also quiet this afternoon. Don't know what's happened. Someone must have a question. Basil.
Hi, Justin. Hi, everyone. So yeah, I was really interested in the way that you used the behaviour change wheel, because I've often seen it used with health behaviours, and that's how I've always used it in the past. So I'm just fascinated to see how it was used in a non-health behaviour. What was that process like? What was the experience of using it?
Well, I've used it. So my background is in public health. So my experience of using it is similar to what you've mentioned there, which is its use in health behaviours. It was actually when it was originally created, its aim was to influence healthcare professionals in terms of take a professional practice. So not necessarily, and then it sort of got picked up by other people in health and used actually for health behaviours. So I guess originally it wasn't really about health behaviors. It was about the behavior of it was implementation science and healthcare professionals putting in guidelines and practice within their healthcare settings. So we're going, in answer to your question, we're going through the process now. So it's something that I'm really interested in, actually. The team that we've got working on this are cross-disciplinary. So we've put a call out for help for people across the institution. We've got people working from lots of different schools in London Met who are coding the papers for us using the COMBI model. So what I'll be doing is at the end of this is, we're going to be meeting regularly as we go through this, is to get their views on what they think of the COMBI model. And initial thoughts from people are that it's actually, easy to use, quite easy to understand. It offers quite a nice systematic approach to understanding this behavior, or indeed any behavior. But I can, the proof will be in the pudding, and actually how do they find it when it actually comes to applying it to the literature that we found, because it's not going to be an equal, it's not going to match the papers we found fully. There might be, and from my experience, people sometimes struggle with which component they relate their finding to. Is it a psychological capability? Is it a reflective motivation? But for me, what I think's really useful about this model is that if you get to the point where you're asking the question, where do I put this? Is it in this component or this component? Then actually that's kind of, that can be sorted out later. The fact that it's been picked up and people are reviewing papers or transcripts or whatever else it might be, and asking the question of that paper and pulling out things are important, when we get to the point of, well, where does it fit? The job's actually already done, because we know it's an important factor, and then we can discuss and decide where it fits later. So, I mean, I've used it quite extensively. I really like it. I'm aware of its shortcomings, but what I think is really good about it is it makes people question behavior in a systematic way, and it makes people question things that can influence behavior in a systematic way, which I think can only improve intervention development and stops people from just doing what they think is a good idea at the time. But it's difficult for me to answer your question fully, because I need to get that really from people who haven't used it as much as I have, who are now applying it to this different context. But we'll get that information as we go through the completion of this scoping review.
Great. Yeah, that sounds, I mean, I definitely agree, and it sounds fascinating. So I look forward to seeing it.
Yep.
Thank you.
If you want to, you're very welcome to help. If you want to code some papers, then let me know.
Well, we've got a few of the health psychology students here as well, so you never know.
Oh, okay.
I'm interested.
Yeah, no, it's open to students as well. So if students want to get involved, then I mean, if you send me an email, I'll put my email address in the chat. Then I've got some details I can send to you. If students want to get involved, if you've got students who think that might be interested in this, then let me know.
Yeah, it sounds like a great opportunity. So thank you.
Justin, just out of interest, just listening to what your excellent description of the of sort of your experience of looking at behaviour change in this context, are you looking at personal or community levels, or both? And if both, do you have a sense of the kind of the balance between them in the literature?
In terms of the influences on behaviour, or ways to overcome it, or both?
Both, actually, just because obviously you could look at it in different ways.
Yeah. So the opportunity section of the COMBI model, the capability, motivation, opportunity, are things external to the person. So how I've applied it in previous projects is taking a socio-ecological model, so looking at the individual, interpersonal influences, community level influences, workplace level influences, the broader organizational macro level influences, and having them sort of down the side, and then having the COMBI components across the top, and then using that as a framework to pinpoint some of the barriers and facilitators to a particular behavior. And that's worked quite nicely, because then it can help in identification of the intervention functions that might bring about change. What will be driven by what we find in the scoping review, really, in terms of the influences on behavior. I think we're coming at this, we're trying to come at it with a completely fresh mind. Is it that there are organizational influences that stop people doing something? Is it organizational influences that can change people doing something? And I'm sure that's the case. So we didn't want to just focus this in. I think when we started, we were probably focusing in on the individual. But actually, I think what we'll find is that there are this whole array of things that are going to influence people. And it's not just about trying to change the individual, it's trying to think about the interrelated behaviors of the determining factors, whether that is a policy level and key decision makers that we might need to influence to bring a change at an individual level. So we'll be looking across the board, really.
Sure. So interesting implications for interventions or policy change.
Yeah, I think so. And I think that when we get to that stage of designing, once we've got through this first and second stage of understanding the behavior and understanding what people think would influence their behavior and what the literature says would influence behavior, when we get to the stage of designing, the stakeholders we involve to co-create that workshop will be very important, because we need to sit down as a research team and say, well, out of all of these things that we found, what do we think and what do key stakeholders think is going to have the biggest influence, and actually what is within our gift or gift of others to change, because then we can, and at that point, that's why we've got to decide where we're going to pitch the intervention, because then the right stakeholders will be invited to come and co-create that.
Sure, thank you, Justin. Has anyone got any other questions for either of our presenters? Well, I've got a quick question for both of you. Just thinking about, you're both doing reviews, different sorts. So I just wondered, Fazala, could you just give us an idea of the kind of timescales involved in doing a review, a systematic review of the nature you've described? Just it might be helpful for colleagues who are maybe thinking of doing this kind of research themselves. Could you just give us a ballpark? I won't hold you to it, but give us a ballpark idea of how long you think it's going to take you.
I think it's going to take me a minimum of another couple of months to complete, and then obviously then it's going to get marked and so on. And I've been working on it for a number of months beforehand as well. And I think it's all more so what you put into it before, up until the point that I'm at now. That's probably the lengthier part. It's taken me months to get to this stage.
Sure. So what would you say if you were to go 6 months for the whole? Forget report writing for the moment, but actually doing the review. What do you reckon?
At a minimum.
Okay. No, that's really helpful, because I think, if people are thinking about doing a review as a standalone project or a part of a bigger project, it's kind of useful to have kind of your experience in terms of the workload involved. Thank you. What about you, Justin? I know the scoping review is part of one part of 3.
Yeah.
But how long is it roughly?
Well, I can tell you in terms of actual, the calendar time has taken an awful long time, but that's because we've had a number of other research projects on the go. I mean, I've been involved in other reviews. Duncan, you and I've worked on one, and if there's any masters in public health students here today, I think the minimum amount of time is kind of 2 to 3 months if you're working on it full time to do it. But we've been doing this review whilst obviously doing the day job as well and other research projects. And I looked back and we ran the searches. It's probably 10 months ago we ran the searches, and then it's taken that amount of time just to title review, abstract review. But that's because we've been doing it with lots of other things. I think if it's a sole project and you're doing a rapid review, then yeah, you can probably do it within 10 to 12 weeks. But getting to the more systematic stage with critical appraisal, then yeah, I completely agree. You're looking at probably six months as a minimum.
That's really interesting, because I think people might wonder why people keep doing reviews, and one reason is that once you've it's actually keeping the sort of synthesized literature up to date, because it takes 6 months to do the review, 6 months to maybe do a report, another 6 months to get it published, by which time your searches are possibly out of date. It's an ongoing process. So thanks very much both for that. We've reached the end of the session, Yolanda, is that correct? So now it's time for a break.
Yes, it's correct. And thank you very much to Fazala and for the presentation, and to Justin. Fantastic presentation we have this afternoon so far. And we will continue when we resume. Let me double check at 2:30. Yes, for session 4. And thank you very much, Duncan, as well, for chairing today.
That's okay. Have a cup of tea, but don't disappear, people.
There's
lots of very interesting talks to come.
Yeah, thank you. Patrick, I can see you there, but we will be resuming at